Hi, I'm Dr. Karen Fink, a neuro-oncologist on the Baylor Scott White medical staff. I'm here to help increase your IQ around brain tumors. Here's what you need to know. A brain tumor is an abnormal growth of cells that cause a mass in the brain. More than 150 different brain tumors have been documented, and they can affect just about any structure in the brain. They fall into two main groups, primary and metastatic brain tumors. Primary brain tumors originate from the tissues in the brain, while metastatic brain tumors are caused by cancer cells that travel to the brain from other parts of the body, for instance, from a lung cancer or a breast cancer. Symptoms that are caused by a brain tumor depend largely on the location of the tumor within the brain. There are some general symptoms that may indicate the presence of a tumor, but these symptoms are much more often due to something else. So it's important not to jump to conclusions if you have the symptoms I'm going to talk about. A symptom that can occur with any brain tumor is a persistent headache, particularly if the headache is accompanied by excessive sleepiness, nausea and vomiting, or blurry vision. Having a first seizure as an adult can be another clue that a brain tumor may be present. But again, seizures are much more often caused by something other than a brain tumor. More focal brain tumor symptoms can be a clue to the location of the tumor within the brain. In general, a tumor on one side of the brain causes weakness or numbness on the opposite side of the body. Tumors in other parts of the brain may cause personality change, impaired coordination, or trouble producing and understanding speech. If you have these symptoms and they don't resolve in a short period of time, you should see your doctor. Although the symptoms I've just talked about can suggest the presence of a brain tumor, an imaging procedure such as a CT scan or MRI scan of the brain are required to detect and localize a brain tumor. A biopsy of a suspected tumor is almost always required to determine what type of tumor it is and what treatment is appropriate. Treatment for primary brain tumors is different than the treatment that is appropriate for patients with a tumor that traveled to the brain from a cancer in another part of the body. As a neuro-oncologist, I treat mostly primary brain tumors, and these are actually not that common. There are only about 24,000 cases diagnosed in the United States each year, so there is far less than a 1% chance that any given adult will develop a primary brain tumor in their lifetime. The majority of primary brain tumors are actually non-cancerous or benign, but they can still be dangerous because even benign tumors can impact the brain's ability to function and can be difficult to remove safely without causing neurologic damage. The most common benign tumors that occur in the brain are meningiomas. They actually arise from the coverings around the brain. They're more likely to occur in women, and the main treatment is surgical. With complete removal of a meningioma, the prognosis is very good, and often these patients do not need further treatment. They just need monitoring with MRI scans. The most common tumor that arises in the actual brain parenchyma are gliomas, and these range in grade from grade 1 to 4. Patients generally have surgery to remove the tumor, and this determines the tumor grade. Tumor tissue will then usually be tested for an array of genetic markers that can indicate sensitivity to particular treatments. Patients may or may not need postoperative radiation therapy or chemotherapy. Radiation therapy is supervised by radiation oncologists, and chemotherapy and other systemic treatments are recommended and supervised by general oncologists or neuro-oncologists. Because we have not found a cure for all brain tumors, clinical trials are an important option for patients. Trials help us find new treatments for both rare and common brain tumors. Treatments for every grade and type of primary and metastatic brain tumors are evolving rapidly, making it a gratifying time to be a neuro-oncologist.